However, I wanted to say that we are also looking for innovative way to raise resources in a way which is a two-way side. Yeah. We are currently working on the pandemic agreement, and we do have a pet or innovative way to raise money, which we call the PAB system, pathogen access and benefit sharing. Whereas your researchers and scientists will come and do science here and collect the pathogens, when we do come to the tail end of what is manufactured for countermeasures, vaccine, diagnostics, and medicines, since we collaborated along the chain, we want to say, I think we deserve to get a benefit back in whatever percentage. For us, we think 20% of the real-time manufacturing is something we can always consider. Colleagues here working on a vaccine, but our manufacturing level has some capacity building to do. We need some high advanced laboratories, so that when we are at maturity level, where we can be able to comfortably manufacture the vaccines, the science is going ahead up of the commercialization and preparation. I think that is something we need to talk about. We also have ideas of having calibration centers which are uniquely placed to help the rest of Africa. You know, UVRI is a center, a reference lab for pathogens and viruses, but we also want to be able to train and build capacity. As you noted, that when we get outbreaks, Uganda does support the rest of the country.
So very important that we hosted him, and he came really because of the strong partnership between Uganda and the UK. This was his first country to visit, if I'm not mistaken, having taken up his office as Minister for Africa. So to prioritize Uganda as the country to come to, we feel very honored. And the reason for visiting us here is essentially because the unit is one of the biggest UK investment in terms of health research. So this unit, the MRC unit here, was established some years ago, more than 35 years back, essentially at the request of the UK government, the Ugandan government to the UK. You remember in the 80s, that's when HIV was really bad. So the UK government responded to that request from the Ugandan government to help with the pandemic by establishing this unit. So we have had a long history of contributing to the HIV challenges, addressing the challenge of HIV. We have a population that we've been following up in Chamlirwa over all these years to see what the trends are, not just observing, but also helping with the interventions. Some of the best interventions that have come out to be utilized, for example, vaginal rings and all these other novel antiretroviral drugs, the tests, the studies have been undertaken by this unit, and including in areas of vaccine research to try and find a vaccine for HIV. So we've contributed a huge amount to that effort. That's what the unit was built here for. But over the years, the research has evolved because of the changing health needs for Uganda. So we now do research in a lot of other viruses. We do research in a lot of trying for vaccines ourselves, not just testing other people's vaccines, but even developing vaccines from within Uganda, with support from the Ugandan government, because President Museveni is very keen that we should develop this capacity, which we are contributing to. But there are other areas like non-communicable diseases, diabetes, hypertension, mental health. All these things are now part of the unit's research portfolio. So the minister really came to try and appreciate that, to see what the UK investment is contributing to the Ugandan health systems in terms of strengthening the systems, in terms of generating evidence that will be crucial. And he also came to see what the infrastructure that is here has been and can be leveraged to respond to national health challenges. So, for example, the sequencing that takes place in terms of understanding viruses, characterization that takes place in this unit is what informed the different waves of COVID. So when people are saying we now have Alpha, we have Delta, which obviously killed a lot of people, you have Omicron, all those analyses to talk about those different variants of viruses. It's these laboratories which you saw here today. That's where these studies or these experiments were undertaken. So very, very useful work that's been undertaken here. And that's why the minister wanted to witness that, to offer that support.